Welcome to the topic drugs for immune system modulation. So in this chapter, we will study about the human body's adaptive and innate body defense systems, or about the immunity. So as we say, the immunity, it's of two types, adaptive immunity and innate immunity. Adaptive immunity can be natural, which is inborn by birth, and the other one is the artificial. And the natural can be maternal via passive, and it can get by infection, that is active. For artificial, it can be again passive with the antibody transfer, and it can be an active immunity, which is caused by the immunization. So innate and the adaptive body defense mechanism, if we study about more, the innate body defenses are the non-specific, they're general barriers to disease, such as like the skin, inflammation, and the phagocytes. Here we can see in the picture. And the adaptive body defenses, they are known as the immune response. They're involved lymphocytes and are the specific to particular threats. So the immune response, it results from the activation of the humoral and the cell-mediated immune systems. These are the steps in the humoral and the cell-mediated immune responses. If we see here, the humoral immunity, it starts from the inactivated B cell, then it activates the B cells and make the clones. And these clones, they are making so many clone cells and they are moving towards either the memory B cell, or they're making a plasma cell, and this plasma cell will make the antibodies. If it's an inactivated T cell, it will again activate the T cell by making the clones. Either they will make the helper T cells, which will further make the cytokines and go to make the antibodies, or they will make the memory T cells. Either memory T cells or memory B cells, they are not working towards the immunity. Only helper T cells, the cytokines, the plasma cells, and then the cytotoxic T cells, they all are making the antibodies for fighting against the infections. Next is the vaccines. They are biological agents used to prevent the illness. And this vaccination immunization, nothing but a process of introducing a foreign substance into the body to trigger the immune activation before the patient is exposed to the real pathogen. And the goal is to induce the long-lasting immunity to a pathogen without producing an illness in an otherwise healthy person. So there are 4 methods of producing the safe and effective vaccination, includes the following. Number 1 is the attenuated live vaccines, which include measles, mumps, and rubella, which is called as MMR. Inactivated killed vaccines, influenza and hepatitis A. Toxoids, which is diphtheria and tetanus. Recombinant vaccines, which is the hepatitis B. Then here is a chart which is telling you about the routine immunization schedules for the infants and children in Canada. So starting with the age of 2 months, we give these vaccines which are cross-X, DTaP, IPV, Hib, C13, MCV, and rotavirus in infancy. If the baby is 4 months, now we're gonna give this one. For 6 months, we are going to add one, or 12 months, we are giving these drugs, these vaccines. 18 months and 4 to 6 years, and 14 to 16 years. Then at 9 to 13 years, we have to give HPV 3 doses, and it is less than 9 years, it's the HPV. So this is the routine immunization for adults in Canada. Vaccine or toxoid, it can be diphtheria for adult, and it is scheduled all adults every 10 years, preferably with the tetanus toxoid or the pertussis, that is DTaP. Hemophilus vaccine at the risk of the invasive Haemophilus influenza type B infection. Hepatitis A, if you are at risk, give 2 doses 6 months apart. Hepatitis B, if at risk, give 3 doses in total at 0, 1, and 6 months. If it's herpes zoster, then for adults older than 60 years, or may be used in the 50 to 59 years old person. Human papilloma virus, the females under 45 years of age and males under 26 years not previously immunized. Influenza is given to all the persons older than 65 years, those at the high risk under 65 years of age, and it is given annually. These are called as flu shots. Measles, all born after 1970, high risk born between 1970, and they are given as MMR. Then is meningococcal quadrivalent, increased risk of the meningococcal disease, and we repeat every 5 years. Mumps, If the person is mum susceptible, given as MMR. Pertussis, all adults, preferably given as the DTaP. Pneumococcal conjugate with specific conditions that increase the risk. Pneumococcal polysaccharide, those older than 65 years or those under 65 years at the high risk. Poliomyelitis, inactivated, those not previously immunized. Rubella, susceptible women of childbearing age and healthcare workers, it's given as MMR. Tetanus to all the adults given every 10 years as the TD or Tdap. Varicella, it is susceptible adults should receive 2 doses 6 weeks apart. Then abbreviations and the brand names of the vaccines used in the immunization schedules are the BCG vaccine, which is called as Bacillus calmette-guerin, BCG vaccine, DTaP, HB, IPV, Hib, diphtheria, tetanus, acellular pertussis, hepatitis B, inactivated polio, Haemophilus influenza type B, pediatrics. And the brand names which comes in the pharmacy as the Infanrix Hexa. DTaP IPV includes diphtheria, tetanus, acellular pertussis, inactivated polio, pediatric, quadricell. DTaP IPV Hib, diphtheria, tetanus, acellular pertussis, inactivated polio, Haemophilus influenza type B, pediatric, pediacell. HA, hepatitis A, Avaxim, Havrix, and Vacta. HAHB, hepatitis A, hepatitis B, Twinrix. HB, only hepatitis B, Energix B or Recomivax HB. HIB, Haemophilus influenza type B, Act Hib. HPV2, human papilloma virus, Cervarix. HPV4, human papilloma virus, Gardasil. So these are the names of the brands for the vaccines they are used. INF influenza, Agriflu, Fluad, Flumist, Fluviral, Influvac, Intenza, and Vaxigrip. IPV is polio inactivated Imovax polio. Men CACYW 135 is meningococcal conjugate quadrivalent, Menactra, and Menvio. Men CC, meningococcal conjugate monovalent, Meningitech, Menjugate, Nesvac C. MMR, measles, mumps, rubella, MMR2 or Priorix. MMRV, measles, mumps, rubella, varicella, that is Priorix tetra. Pneumoc 13, pneumococcal conjugate 13 valent, Prevnar 13. Pneumo P23, pneumococcal polysaccharide 23 valent, Pneumovax 23, Pneumo 23, Imovax, rabies, and Rab Avert for rab and rabies. Then we have Rot1, rotavirus monovalent, Rotarix, Rot5, rotavirus pentavalent, Rotatec, TD, tetanus, diphtheria reduced, TD absorbed. Tdap is tetanus, diphtheria reduced, its cellular pertussis reduced, its adacellal boostrix. Tdap, IPV, tetanus, diphtheria, acellular pertussis, and inactivated polio with adacell polio or boostrix polio. TD, IPV is tetanus, diphtheria, or inactivated polio. It is TD polio absorbed. Type 1 is typhoid injection, typhim VI, and typhrix. Type 0 is typhoid oral and vivotif. VAR is varicella or chickenpox, varilix, or the varivax 3. Then there are 2 types of the immunities obtained. One is active immunity and the passive. So in the active immunity, the body produces its own antibodies in response to the exposure. And in the passive immunity, their performed antibodies are transferred from the one person to another. Gamma globulins, which is for the hepatitis or chickenpox, antivenom sera for botulism, tetanus, and the rabies. So this is the mechanism of active and passive immunity. What happened when the plasma cells, they are exposed to the antigen or to the vaccine, then antibodies, they neutralize or destroy the antigens. Or the memory cells provide the long-lived protection and the antigen A exposure occurs. And this is the response from the antibodies. Immunoglobulins are released and they're rapid but short-lived. So what happened? Active immunity, how it is acting? Administration of the vaccine or exposure to an antigen stimulates the body to produce the antibodies and the memory cells. Then we give them as the booster vaccine, which is administered months or years after the initial vaccine. Booster vaccines stimulate the immune system to maintain the enough memory cells to mount a rapid response to an antigen. So then the passive immunity occurs, the administration of immunoglobulins or antibodies, which gives the passive immunity, which has the fast onset but lasts only 3 to 6 months, not more than that. Then we have some biological response modifiers, which are used to boost the immune response. They are like interferons, and this interferon we can see here, it's kind of the interferons, they are releasing the signals enabling the uninfected cells to destroy the RNA and reduce protein synthesis. This signals the neighboring infected cells to undergo apoptosis, that is the cell death, and activates the immune cells. So interferons are written as IFNs. The cytokines, they're secreted by the lymphocytes and the macrophages we can see, and slow the spread of the viral infection. So these interferons, these cytokines, they slow down the viral infection. They enhance the activity of the existing leukocytes in the body. Other than that, we have interleukins. This is also called as IL. So interleukins example is levomasol example or argamisol. This stimulates, what do? They stimulates the B cells, the T cells, and the macrophages in the patients with the colon cancer. We give the vaccine called as BCG, Bacilli calmette-guerin, or TICE therasis. It is an attenuated strain of Mycobacterium tuberculosis, which is used for the pharmacotherapy of certain types of the bladder cancer. Then we use some immunosuppressants. They are used to prevent the transplant rejection and to treat the autoimmune disorders. So the people who get the transplants, like organ transplants, they have to be onto the immunosuppressants so that we can treat the autoimmune disorders in their body. So these immunosuppressants, they lessen the immune response following the organ transplant. They indicted in the autoimmune disorders when body creates antibodies against its own cells. They work by suppressing the lymphocyte function, and the most are toxic to the bone marrow. They increase the chance of infection due to decreased immune response. So these are the drugs which are used for the immune system modification. Biological response modifiers: aldesleukin, interleukin-2, interferon alpha-2b, alpha-con-1, beta-1, beta-1b, and PEG interferon alpha-2a. Then we have immunosuppressants as the thioprine, basiliximab, cyclosporin, lymphocyte immune globulin, anti-thymocyte globulin, methotrexate, muromonab CD3, mycophenolate, sirolimus, tacrolimus. So a summary of this whole topic is that the body engages a mediated immune system response when it encounters a perceived threat. Vaccines are the agents that prevent the illness, and the biological modifiers, they boost the immune response. The immunosuppressants that we studied at the last, they assist the body in preventing the transplant rejection and combating the autoimmune disease. So this is all about our immune system modulators. Thanks for watching.